Hey all, this is Keisha Nicole. Welcome. I know we've all been affected by COVID-19. Some of us directly, some of us indirectly. We know family members that's been affected by COVID-19. I know I've lost several family members from COVID-19. And now we are here a year later and the vaccines have hit. Now, I know for a lot of my listeners, they've had questions about the vaccine. Should I take the vaccine? Maybe I shouldn't take the vaccine, but it's important that we get the truth out and we understand what's happening and why it's so important for all of us to take this vaccine. So we have a panel of excellent professionals and doctors who are board certified, who's going to get down to the wire of this today. First, we'd like to introduce Stephen L. Williams, Director of Houston Health Department. Welcome.
Thank you. Glad to be here.
How are you today?
Oh, I'm doing pretty good. You know, of course, life for the last year has been pretty hectic.
Yes,
it's been all things COVID.
Yeah, all things COVID. Well, thank you for everything that you've been doing.
You're welcome.
Yes. Now, we also have Dr. Higgins, specialized in mental health disorders. Welcome, Dr. Higgins.
Oh, thank you so much. I'm happy to be here to be able to talk about mental health in the Black community, especially dealing with this COVID-19 virus.
And we also have Dr. Felicia Jordan, who specializes in internal medicine. Welcome, Dr. Felicia Jordan.
Hi, good afternoon. Thanks so much for having you. It's a pleasure to discuss this very important issue about the COVID-19 virus and the vaccine. Thank you.
So I first want to start off, with the basics and how does this vaccine work? Because now we have several vaccines out now.
I'll take that question. So when we talk about the vaccines, first of all, in the United States, there are currently 2 vaccines that are approved for emergency use authorization. Both of these vaccines use something that's called mRNA technology. So let's break down mRNA technology, because I know that's sort of the buzzword nowadays. And I really want everybody to understand exactly what it is and exactly how it works. So mRNA is actually short for messenger RNA. It's a single strand RNA that is inside of a cell. And the way the vaccine is given is basically a blob of fat, if you think about it. And the mRNA is inside of it. This is then injected into the upper arm, the deltoid muscle, and goes into your body. Once the mRNA is in your body, it does just what the name is, messenger. It basically gives instructions or a blueprint to your body to make a certain specific protein called the S protein. Now, the S protein or the spike protein is what's actually on the outer portion of the coronavirus. Now, the messenger RNA tells your body to basically make this spike protein. The spike protein is what actually attaches to your body in order for the corona to get in. But it's basically making a duplicate of the spike protein. Once your immune system sees the spike protein, it then goes on to make antibodies to fight it because it knows it's not something that's supposed to be there. That's basically what we're getting an immune response to with the antibodies. So the body is smart. The antibodies have memory. So down the line, if you ever get infected or exposed to the actual coronavirus, this spike protein attaches to your cells, comes inside your body. Now, those same antibodies that were made because of the vaccine basically is sitting in the gut. It sees that spike protein and it's like, wait a minute, I've seen you before. And it's actually ready to attack. So in basic terms, that's basically how the vaccine works.
Now, I know everybody has this question. Are there any side effects, or what are the side effects if there are any?
Okay, so there's basically 2 ways that we need to talk about. One is what's called an allergic reaction, meaning anaphylaxis. That's actually extremely rare. It's been, about 21 cases where you actually have a severe reaction to the vaccine. This usually happens in 75% of people in the first 15 minutes. So that's when you get the vaccine. They usually say you need to sit for the 15 minutes. That's when you have the highest difficulty breathing. That's an actually very rare occurrence. Now, what is more common is what we call side effects of the vaccine or the reactogenicity of the vaccine. This is things you get pretty much in any vaccine you get. A little bit of soreness in the arm. You may have a little bit of redness in the arm. Within the first 24 to 48 hours, you may have a little fatigue. You may have a little bit of nausea, things like this. Because I know when I had my first vaccine, the first shot that I had, I actually did have some soreness in the arm. I took some ibuprofen and I was fine the next day. For my second shot, I had a little bit of the soreness, not as much as the first one, but I did have a little bit of fatigue the next day. Typically, we say these side effects will go away in the first 2 to 3 days.
Okay. Now, you did mention there are 2 vaccines, right? There's Moderna and there's Pfizer. What's the difference between those 2?
So they're actually very similar in that both of them use what we call the messenger mRNA. The Pfizer vaccine is actually approved in those 16 years and up. It has a 95% success rate in preventing severe hospitalizations or severe disease. The Moderna vaccine is approved in those 18 years and up. The difference between, they're both 2-shot vaccines. The Pfizer vaccine is given after 21 days. The Moderna vaccine is given after 28 days. Moderna vaccine has a 94% efficacy. The Pfizer has a 95% efficacy. There are some other small differences as far as how they're stored and the temperature, but they're very similar. Now, even though they're similar, they're not exact. So we usually do try to tell people that whatever vaccine you got the first time, you really should be trying to get the same one the second time.
Okay, and I want to ask Mr. Williams. Right now, there's different phases. You know, this phase can go before my granny. She got it. She was like one of the first people to take care of it, and was like, I got to get in there and get it. My mother as well. But as I know, everyone can't get it right now. How do we determine the phases, and when will this first phase be over with so everyone else can get it?
Right now in Texas, phase 1A and 1B are eligible to get the vaccine. This is determined by an expert vaccine panel that provides recommendations to Dr. Hellerstadt, the Health Commission. I'm actually a member of that committee. Phase 1B is actually those individuals who are working in healthcare or healthcare related field, and also those individuals who are residents of nursing homes, long-term care facilities. Mm-hmm. Phase 1B are those individuals that are 65 years and older, or those individuals that are 16 years and older who have certain chronic conditions. A lot of folks actually compute, you've heard people talk about essential workers or whatever, but the bottom line with how Texas looked at this is anybody that's in any employment sector that is actually 1A or 1B can actually get the vaccine now.
And you know, with the Houston Health Department, you know, what are they doing to provide the vaccine, especially to like vulnerable communities?
You know, we in public health have really been concerned about vulnerable communities since the inception of public health. We only get about 9,000 doses of vaccine a week. Part of that vaccine actually goes to our health clinics. We have 4 health clinics who have been in existence for several decades. We have one in Sunnyside. We have one in the southwest Sharpstown area. We have one in the north side and one that is in near north side called Casa de Amigos. We also have a central storage facility for vaccines, and what we furnish vaccines now for the Bayou Center, as well as our drive-through, which is actually operated by UNMC at Del Mar Stadiums. But in the last 3 weeks, what we've done is actually transfer vaccines from our supply to a couple of federally qualified health centers. The first clinic we sent vaccine to was the Hope Clinic, which is in Southwest Houston. We also had arrangements with El Centro, but they eventually got a vaccine that's located in the near east side. Last week, we partnered with the hospital district's Sedigas Clinic and provided vaccine to them because we really are interested in ensuring that folks that are in the Black and brown communities get the vaccine. One of the things that I've been doing as a member of the advisory committee is advocating for the hospital district clinics to actually get 15,000 doses of vaccine because we know that they are in fact seeing our people. Next week, well, Saturday, we're going to be at the Hospital District's Gulfgate Clinic. That is in the Southeast because when we look at the data, there are several zip codes that have high positivity rates, and there are several zip codes that we have classified as being high for COVID vulnerability. And there are a number of factors that we look at to determine whether or not it's a COVID vulnerability indicator. Unfortunately, there are a few dozen of those inside the city of Houston.
Would you say we're like on track? I know for the people that are watching right now, that are at home, would you say like we're on track as far as like the supply and vaccines and everyone being able to get one?
No, that's related to the scarcity of vaccine. You know, I sit here as the health director, and I've been here for about 16 and a half years. And I knew intellectually that it would be a slow rollout, but I can tell you that I'm even frustrated because I see that the demand is very high now, and the supply is just not there to meet the demand. Although intellectually, I know that. I think everybody know that. But when you see people waiting in line wanting the vaccine, you really want to save lives.
I saw someone just posting that I took my vaccine already.
Well, I think if you talk to the doctor, yes, you took your vaccine, but that doesn't ensure that you're not going to have COVID.
But let's talk about that, because I think some people, that's what they think. I get the vaccine, I don't have to wear a mask anymore. I can go out, I can live freely. I don't have to be cautious. You still have to be worried about maybe getting, COVID down the line, or how does that work? Because I think a lot of people are confused about that.
Well, I'll address the protection part, and I defer to the doctors to tell you how the vaccine actually works and what it does. But we're still advocating that people continue to mask up, even though they've been vaccinated, continue to social distance, not really participate in crowds or in settings where there are crowds, especially if you're going to be unmasked. We have always advocated for hand washing and good hygiene. And now what we're saying is that you need to take advantage of testing, especially if you've been in certain environments. And when your time comes, take your best shot. Take the vaccine. The doctors, I defer to them in terms of telling you exactly how the vaccine works.
Yeah. I have a couple more comments. So a couple of things. So one, I definitely agree with the director. Even though you have been vaccinated, number one, the vaccine does not give that protection, at least until a couple of weeks after the second dose. So after the first dose, don't get Lightfoot and pull off your mask and say, I'm free. It doesn't work that way. The first dose is really only 50% effective in decreasing the incidence of the virus. The second dose, after 2 weeks, that's when we start getting that 94 and 95%. And I want to give a clarification about those percentages. Those 94, 95% are decreasing the incidence of severe disease. Okay, so that's number two. Number three, even though you have been vaccinated, you may be that 95, 94%. If your whole crew has not been vaccinated and you're still around them all the time, that is still increasing your chance of getting it. So, I see people still out and about, and I get it. I was young too. I want to be out too, but it is not worth the risk. So even though you've been vaccinated, please still wear your mask, still social distance, and attempt not to go into these huge crowds.
Would you suggest when you do go, if they do, and they're not listening, they do go into these huge crowds, should they go get tested immediately?
Well, I wouldn't say immediately, because we know that most times it takes at least 5 days to get that positive result, because I've seen people try to come in and something happened over the weekend and now they want to get tested, just like a pregnancy test. Something happened over the weekend. Now you want to just run and get tested, but you need to give it some time so that it'll actually show up. So if you think you had an exposure, going back to the basics, quarantine until you can actually get tested. Wait those 5 days. And while you're waiting, quarantine and wear your mask.
And while we're on this, I know we have tons of questions. I saw somebody just pop in and says, does a vaccine weaken the immune system for persons who have underlying medical issues and are afraid it might affect their underlying issues? Please advise.
So, and I don't want to take over the situation, so Dr. Higgins, jump in as freely as you like. But my answer to that is no, it does not weaken your immune system. In fact, the only contraindication for taking the vaccine, meaning those who should not take the vaccine, is anybody who has had a severe anaphylactic reaction to components of the vaccine. Not even if you've had an allergic reaction to penicillin or allergic reaction to possibly another vaccine. That's why we say 15 minutes observation after the vaccine. And if you have had some type of reaction to a medication or some other allergic reaction, 30 minutes observation after the vaccine. But actually, people who have underlying medical conditions are the ones we actually do want to get vaccinated, because those are the ones, it has been shown with the data, people who have underlying medical conditions are the ones who have higher percentages of death and morbidity when you actually get COVID. So if you have an underlying condition, whether it be the diabetes, the sickle cell, obesity, the hypertension, the cancer history, the solid organ transplants, dialysis, chronic kidney disease, these are the people who actually really need to be vaccinated.
And Dr. Higgins, from a mental perspective, I hear it's talking to our listeners daily, especially us, African Americans, people of color, they're very hesitant to get the vaccine. Why is that?
Well, a lot of it is some of it is true and untrue. All right. So when I say true, in that there are reasons to be cautious, but then untrue in that you should not get the vaccine because of these cautions. So the work that you're doing here today is very powerful in getting good information out. And Dr. Jordan was doing such a good job that I didn't want to get in the way of her dropping time and saving lives as we were speaking. So there is some truth to the fear of the medical model, and we have to take that into understanding. In that, as we hear a lot about the Tuskegee syphilis study, where Black people were treated poorly, and they were in a research study, many of them not knowing, and many were allowed to die, and that were a ripple effect throughout that entire community. And then also, you even think back to slavery, from the times that when we came to how we were treated at that point. And then you even look at today, right now, where people will, when we go to the hospital, you have poor outcomes for Black patients. We have poor outcomes many times when seen by white doctors, or doctors are not of our race. So there is reason for that fear. But then when there is correct information, we have difficulty sorting out the truth from what is false, which actually can lead to even more death. So the important thing is that you have doctors such as myself and Dr. Jordan, people such as Stephen Williams with the city, and a mayor, all of whom were Black, but also many of the researchers on this product are Black as well. And so you have some very smart, very powerful people within the decision making. Even my alma mater, Meharry Medical College, Black Medical School, they're a part of the decision making on what is good and what is not. People are part of that research, so we have to be able to understand that. But then also, much of the misinformation that happens. We have a lot of bad information that goes out that honestly, sadly, not to be conspiracy theory myself, but it's propaganda that actually is damaging to the Black community. So the fears that are out there, but then there are a lot of lies that are being told, sent on Facebook, sent on social media, TikTok, Instagram, where some guys on there, hey, I just heard that it's 5G coming from the towers. They don't want anybody to know.
I heard that one.
He was up in
I heard that one.
Right? So are they listening? All that old silliness. I believe that propaganda coming out that actually is killing the Black community, being spread by our people because of a lack of knowledge and lack of understanding. So one, is the vaccine safe? Yes. Has anyone died from it? We don't think so. Maybe one or two out of 20, 30 million people who receive these vaccines around the world. How many people are dying of COVID in America? About 1 in 60. 1 in 70 have died from COVID. Well, I'm sorry. Those who have died, 1 in 1,000 Americans have died from COVID. About 1 in 800 Black people in America have died from COVID. And if you get COVID, you have a 1 in 64 chance of dying. All right. So if you get COVID, 1 in 64 chance of dying. The vaccine, 1 in 20 million. All right. So you do the mathematics of which one do you want to take your chances on. So the fact is that reason for caution, yes. But at the same time, the caution should be, I don't want to get COVID. In that enough people now have had COVID and have COVID that either you're waiting to get the vaccine or you're waiting to get COVID.
Waiting to get COVID.
Which one you want to be on? Which one you want to be on?
That's so
So
true.
you're passing up people every day who have the COVID virus. And the other thing that I heard somebody say today, a patient of mine that I had to correct, he said, well, since I already have it, I'm good. Or people will say, since I had the vaccine, I'm good. No, you still can get COVID again. I have a friend right now in the ICU fighting for his life, who's a medical doc, who probably got it out of his hospital, who's had it now for the second time. And the second time was a lot worse than the first time. So you cannot believe that I got the vaccine or I got COVID, I'm fine right now. We have to get good information out to our people, because if not, we will die. And then we got to get the vaccine out to people. But understand this, the death, as you can see these disparities roll out. Where's the vaccine going and who's getting it in their arm? It's still today true that we're not treated the same, that the system is the deck is stacked against us, and that's even rolling out of the vaccine and getting into arms.
And I want to unpack like what's happening to us mentally. Like I've had several family members pass away from COVID-19, and you know, we can't have funerals till like 4 months later. And then you don't want to go to funerals. Some of them not having funerals. And then you talk about people staying at home. You have to see your husband and wife more often than you've ever seen them before. And then domestic abuse rates are going up. Then you have kids sitting at home in front of a computer, can't concentrate. Like mentally, a lot of us are going to be messed up once this pandemic goes away, and at least right now.
Well, one thing that we're not covering right now is the mental health pandemic that is going on. We're kind of leaving that portion out. I know me as a psychiatrist, the phone is ringing off the hook. I mean, we're constantly in waiting lists, not able to get everyone in. I don't know a psychiatrist who's not busy, who doesn't have a waiting list at this point. So suicides are going up, overdoses on substances are going up, accidental overdose and intentional overdose. Kids are having difficulty with being out of school because there's a part of us that must socialize with individuals. We're you know, it's like we run in packs as group. Everyone has a social group and a social order, and that being disrupted. And normally as Black folk, whenever we're disrupted, where do we go? We tend to go to church. But now that is disrupted. You know, the ability to get with your boys or your homegirls and talk it out, that is disrupted. So now a lot of us are out there on the fringes by ourselves. And as you stated, with this domestic violence issue, people are frustrated, people are out of work, people are out of jobs. So I tell people we need to just cool out, you know, for lack of a better way of saying it, take a chill pill, everybody relax, calm down, and realize where you're at, what you can do to stay safe and ride this out, understanding that viruses are nothing new. Pandemics are nothing new. We make adjustment and we make changes. HIV changed the dating game a lot, right? So people had to learn to do things differently. It doesn't mean you can't date, doesn't mean you can't have relationships, but there's a level of safety that must happen. So we're looking at the initial issue, and then we're looking at the long-term consequences, the PTSD, the loss of family members, the people who were close to you, who were there. And I just heard a person that I know that I just a few days ago I heard died, and I'm like, I just saw the guy. You know, and what happened? So we have these issues. You know, I'll do a shame. Can I do a shameless plug?
No, go for it. Go for it.
This book is almost out. It's called Bree's Journey to Joy, a story about childhood depression and grief, and it has a parent guide about COVID-19 and how to talk to your kid about it. So that this book is to help people understand that, see the traumas that occur, and also make sure we pay attention to the children. So often the adults are upset by not noticing that your 4 and 5 and 8 and 18-year-old are struggling as well, because we're dealing with our own things. So it's going to be important for us to make sure we understand our mental health, pay attention to our mental health, understand that these things are not normal. All right. So if you feel stressed right now, you're supposed to be. It's your body letting and your brain letting you know to be a little bit more attentive about how we're doing life right now. But I tell folks, this too shall pass. As we get this vaccine rollout going, as people get vaccinated, then as a community, we become safer. And what I do want to say about that is, until we get, as they call it, herd immunity, whereas if I got vaccinated, but my colleague right here sitting next to me on the microphone is not vaccinated, and we've got to sit next to each other every day over the next 6 months, and if they have the virus, I'm 95% protected, but I'm not 100% protected. So every time I see them, they re-challenge my immune system, re-challenge. The virus, the vaccine teaches your body to fight the virus. So what if you have to fight every day for the next 6 months? Chances are it only takes one time to lose. All right. So if everyone is not vaccinated, it only takes your little nephew to come home with COVID from school to get grandma sick and she died. It's sad. I'm hearing these very sad stories. I heard this one story where this guy said his sister came home, visited family, went back to where she was going, all right, where she was living at with her husband. Did not mention that she had gone out to a hookah bar on a very popular street here in Houston. Went back. They had a small gathering for Thanksgiving. 5 people were there. Those people went back to their homes. 19 people in this family got sick, and she ended up killing her mother-in-law. One decision, one bad decision. I'll just hang out with my homegirl from high school real quick. We'll run up to the spot, come back, didn't tell the family, said she did the protocols she was supposed to do, but then killed someone in her home. This is happening all the time. And so do not think that your vaccine will help prevent that, will stop that. It will help prevent it. But until we all come into compliance, the more people, until we all get the vaccine, until we all put on our mask, this is going to be a problem. And trust me, COVID-19 can be over by summer if we can get vaccinated and people put on their masks. It would be over. But every day I've got to help correct a patient. Like, no, you can't do that, or you shouldn't do that if you want to keep yourself safe and the community safe as well.
Right. And can I just chime in on one more thing with that? Dr. Higgins brings up a huge point, because I know 97.9, your listeners are a little bit younger, and they're probably like, that's for old people, young people. If I get it, I get it. I'm just going to have the flu, and that's going to be it. So a couple of points. Number one, I did look at the data for Harris County, and actually the biggest group of people who get COVID in Harris County is ages 20 to 29. They're actually the biggest group who gets COVID. The next group is 30 to 39, and the third largest group is 40 to 49. Now, granted, that 20 to 29 group, their death percentage is not as high as the 40 and 50-year-olds, but they're actually getting it the most. So what happens, you have a lot of people in these multi-generational households. And so you have this 20-year-old who maybe went to the club, went to go hang out or whatever. They have COVID. Now, they may not get hospitalized, but now they've brought COVID back to Madeira, grandma, auntie, or their parents. And because their immune system is weaker, they pass it on to someone who may not do as well. And so now you end up having a parent or a loved one in the hospital because of the decisions that a younger person made. So I really want to express to those in those younger categories that this is about all of us. So those decisions that you make and what you want to do is really going to affect some of the people that you actually care about.
Dr. Jordan, I have questions about the long-term effects of COVID-19, because I hear for everyone it's been different. I've heard stories. Someone said I'm losing my memory a little bit, or somebody said I'm having a little brain damage. I've heard everything, nerve damage. Can you tell us about the long-term effects of COVID-19?
So because the virus is new, we do have limited information about what the long-term effects are. But what I can tell you is that they are real. A lot of and you're right, everybody is different. I've seen some people that literally I just had some allergies and they were fine.
Right.
But then on the other spectrum, I have patients who have these chronic coughs, who actually have difficulty breathing. Some of these people who used to be gym rats,
right?
3 months, 4 months down the line, they still can't get on the treadmill like they used to.
Right.
And so the respiratory effects and the long-term effects of the lungs is a big thing. Some people complain of, fogginess and thinking. And so a lot of people complain about that. We even have people complain about long-term effects, with heart, because if you get sick enough, you do get damage to your organs, and it takes a long time to heal. And so I know a lot of people become flippant. It's like, oh, if I get it, I just get it. But the problem is, you don't know which side of the spectrum you're going to be on. You don't know if you're going to be that person who just has the allergies and gets fine after a couple of weeks, or the person who's going to be in the ICU and now 6 months down the line, you're still on oxygen.
I know I heard my grandfather had COVID pneumonia and passed away, and I've been hearing a lot of people say, or older people say, you know, I had COVID pneumonia, or I have COVID pneumonia. I've been hearing that a lot too.
Yeah, and so because it is a, you know, respiratory virus, you know, that is one of the more severe inflammatory responses you get is in the lungs. And so most of the people who get hospitalized is usually due to decreased oxygen levels and the hypoxemia. And, you know, they're at home, can't breathe. So they end up in the hospital, whether it's on, you know, a nasal cannula, whether it's on face mask, or whether it's on a ventilator. And, you know, if you remember back when, you know, that first peak happened, being on a ventilator, it wasn't quite a death sentence. But at one point in time, 75% of people who ended up on a ventilator did not leave the hospital. Yeah. And so when you start talking about, I don't know what's in that vaccine, I'm not sure, I don't know about the effects, I do understand that, and I'm not going to dismiss it because everybody has their opinions and their fears about that. But the reason that I ended up taking the vaccine is because I saw with my own eyes, okay, this is going to be the alternative. And as Dr. Higgins say, you're waiting to get COVID or you're waiting to get your vaccine, you know, which one do you want to be? And so for me, I did the vaccine. You know, I'll briefly tell you, I had a very, very dear friend of mine who actually was my intern during residency training. She's a family practice doctor. Well, she was a family practice doctor in Atlanta, Georgia. And she had some underlying health conditions. And I spoke with her. I was like, you know, maybe you should think about doing telemedicine. I was like, you know, I'm not sure at this point in time if you really need to go back into the office because, you know, Atlanta was a hot spot. And, you know, financial reasons, you know, people want to be out there and help their patients. So she made the decision to go back to work, ended up catching COVID. You know, she's younger than me. She was in her 40s. Wow. Caught COVID, deteriorated, ended up on a ventilator, and a month later she passed. Wow. So, you know, this is real. And again, it is a personal decision on whether or not you want to get a vaccine, but the alternative to catching COVID is not lackadaisical. It really can have some detrimental long-term effects. Okay. And, you know, just here, you know, globally, we've had 2.3 million deaths in the US. We're right under 500,000 cases of deaths. In Texas, we're about 40,000, and just in Harris County alone, it's 3,000 deaths. So, you know, I don't want to be the person that, you know, wants to scare you into doing it, but I really want people to really listen to these numbers. And, you know, these are people's, you know, brothers, sisters, parents, you know, sons, daughter. And even though the percentage of people who die from COVID is on the spectrum of older people, when I go to the hospital and work those COVID units, there's 30-year-olds on ventilators, there's 40-year-olds. So just to make sure people know that just because you're on that younger end spectrum, you know, you aren't completely protected not going down that road.
And Dr. Jordan, if I could add, they've shown that 62% of people, over 6 out of 10 of people who develop COVID, even mild symptoms, go on to have long-term issues.
Wow, 6 out of 10?
Over 60%. So be it. So my friend, he had COVID. The one who got it twice, but you know, he had mild symptoms, fatigue, and then it developed to he had a rash. Next thing you know, he developed a fever again, and then he started having heart issues. All right, so he's in right now behind the heart issues. So realize that COVID can move around. It can hit different organs of the body. Yeah. And you don't know which one is next. You don't know if it'll go away and come back. But the fact that that a person, a healthy individual, get COVID and never be able to exercise again. Ooh. You know, you have to think about that. Or where is it going to hit next? So we don't know this virus well enough, but we do know that one thing we do know, as somebody asked about, is can the virus mutate?
Yeah.
How many times can it mutate? Well, understand that viruses mutate all the time. The way that they live is they get into you, attach, they mutate, and try to exit your body to somebody else. So that's why the flu vaccine is once a year, because the influenza, B constantly is a thing that's going to switch, is going to change. And so with this COVID virus, it's switching and changing as well. But the way it becomes, they call it viral videos for this reason. The video is entertaining. It attaches to you or to your computer or your device, and then you share it with your friends. All right. Be it, say, like the silhouette challenge or something like that, or the drop it. Everybody does it. It looks a little bit different, and then you share it. So that's what the virus does in order to stay alive. It's called a viral video or a virus simply because it gets in you, takes over, switches, changes out to the next person. So by other people getting vaccinated, I'm now have protection against your different every time it's shared, I have protection against the sharing. So that's why it's important that we all get checked, get tested, get the vaccine, and be safe. The fact is that you can shut the whole thing down. It does not have, we don't have to live this way. But every time I drive down Alameda, and I'm not going to talk about the places that I've seen, when I drive down Alameda and the places are packed and the bar is hopping and everybody's laughing and talking with drinks in their hands, I'm like, okay, some people see a party or a good time, and I'm like the movie Sixth Sense. I see dead people. Some of those people in that room are going to die. They're not going to be there for their niece's graduation in a few weeks. They're not going to be around for that. And they're going to take it home and spread it to other people and spread it to people on their job, because I'm sure there's someone, a loved one, a spouse, a friend, or a brother who is not ill, who you all share the same air with, who now becomes ill, and then they share it with somebody else. So it's deadly behavior to not follow the precautions that I'm seeing happen. And it's deadly behavior to share bad information.
Right. Well,
You know, I think that what y'all saying is very important. And I drive down the same street. As a matter of fact, my office is about less than 10 minutes from that strip. And it is, yes, it is a personal decision as to whether or not you engage in certain behaviors or whether or not you accept the vaccine. But what you said earlier, I think is more important. You're making decisions about other people that you're likely to really care about. And so it's not just about you. And what, if it was just about you, and, I would say, okay, you make that decision for yourself. But you're not making that decision for yourself. You're making it for your family, for your friends, for your siblings, for your children, and certainly for your parents and your grandparents. And I just stress that you really need to put it in that perspective when you're making a decision to go out to a bar and openly have drinks in a crowd of people, or you're making a decision to not get tested, or you're making a decision to not take that vaccine.
Does where you live determine if you can get the vaccine, Dr. Williams?
It does influence it. And the reason that I say that is because I talked about COVID vulnerability communities, and certainly socioeconomic vulnerabilities impact access. Whether or not you have access to technology, you understand technology, will determine whether or not you're able to go online quick enough to sign up for a vaccine. We in the health department have decided to not only have people sign up through a link, but we also call people. We call people back. When we have lists of literally tens of thousands of phone numbers that have called us and not been able to get in. And we call them back, get information, and ensure that those folks get vaccine. This is very similar to testing. There are a lot of folks that have to work and don't have the flexibility of taking off during the week, and so therefore we want to make sure that the vaccine is available on weekends. And also there are people, even on the testing side, that will not take a test because they know that if they come up positive, that they need to isolate, self-isolate. And we've had people that we've called that were actually positive for COVID, and we try to get in touch with them. When we ask where they are, they're at work, and we ask why. You're exposing people, and the answer was that is the only person in this household actually working, and so if that person don't work, then we're likely to end up homeless. And so yes, where you live does impact access. It impacts your response to COVID and to testing as well as to vaccines.
Is there anything that we can do to expedite that process for the vaccine to get out?
Well, scarcity is always going to be a challenge for the next months. And that's probably one of the main barriers. But I think the issue of hesitancy will soon surface when vaccine is readily available. I think you have to do things that we're doing, have professionals that look like the people that we're trying to influence actually talk to our people. I also believe that, you know, we have to engage in more what I call street outreach. Our people actually respond to what I call high. It can't just be on a billboard. It can't just be a public service announcement. That message has to come from people who folks really trust, who people are already acquainted with. That's one of the reasons you've seen some public employees that have high visibility, like the mayor, take the vaccine, so people will see. Yes, it's been, you know, 2 weeks since he's taken the vaccine. His toes haven't curled up and he hasn't turned green. You know, that's what some people are wondering. You know, is it going to impact your DNA? Of course not. You wouldn't have these professionals who really care about folks, because otherwise they won't be in the helping professional sit in front of you and tell you, you know, this vaccine is safe. And I think one of the doctors referred to this earlier. You have a group of professionals that have actually looked at this very closely. They would be singing a different song if it were not safe.
Mm-hmm. Mm-hmm. Well, I know that you know, I've been having thoughts myself about, you know, oh my gosh, should I take the vaccine? Should I not take the vaccine? This has scared me straight. I will say that. Talking to you all today. But where is the vaccine? So seriously, guys.
Can I answer one question that was brought up a little earlier? And it's a very common question, so I wanted to make sure it was addressed. Someone asked if they have already had COVID, do they still need the vaccine? And so I wanted to make sure that they got their answer. And so what scientists are thinking right now is that if you have had COVID, you do have those antibodies. However, they're saying for natural COVID infections, those antibodies last up to approximately 90 days. After that, as we said before, you can get reinfected. So even though you have had COVID infection, you still need the vaccine also. Now, what we are saying as far as the timeline is that you definitely need to wait at least 14 days or until you don't have the severe symptoms and the fevers and whatnot, because you're not going to want to go to a site when you're still sick, but a minimum of 14 days after infection. And you can go up to about 90 days before you get the vaccine, but you should definitely get vaccinated even though you've had COVID infection.
If one needs to register to get the vaccine, where can they go, Dr. Williams?
Well, we're asking people to go on our website at houstonemergency.org/COVID-19.
Mm-hmm.
What you will find there is different sites that actually have vaccine, or you have phone numbers that you can call. I just want to acknowledge that, you know, people have found it difficult because there are extensive waiting lists, but that will soon disappear after more vaccine is available. So we're encouraging people to be patient. And if you're in that 1A or 1B category, please try to access the vaccine.
Dr. Higgins, Dr. Jordan, Dr. Williams, any of you want to say any last closing remarks before we end this conversation?
Well, of course, I have to say what we are promoting. Continue to wear that mask.
Yep, absolutely.
Social distance, physically distance, engage in good hygiene and hand washing.
Mm-hmm.
Get tested if you know that you've possibly been exposed. And when it's your time, take your best shot.
Okay. Yes. And I just want to, you know, reiterate that I have a lot of patients, you know, as the director said, who don't want to get tested because they just don't want to know. Mm-hmm. But burying your head in the sand is not going to make it go away. If you're symptomatic, please get tested. You know, you may have a house full of kids who go to school. You don't want to be that contact tracing person who is now sending kids to school, and now KISD or HISD or some school is shut down because you didn't want to go get tested. Right. So that's number one. Be safe. You know, we still need to go to grocery stores. There's still things that we need to do just logistically, but please wear your mask, wash your hands, And when the vaccine is available for you, please get the vaccine. The other thing I want to touch on, we were talking about hesitancy in the African American community, and I just want to give that name shout out, Dr. Corbett. You know, she's a bad sister. She's one of the ones who worked in NIH, National Institute of Health, who was on the forefront of getting the technology for this vaccine, African American woman. So there are still us, you know, who, you know, have helped develop the vaccine. There's us who's been on advisory boards. And so I don't want people to think that, you know, there's not enough African Americans involved in this whole process. And like the Moderna and the Pfizer trials, there were, you know, African Americans in those trials. So we do know it works in African Americans too. And those would be my parting words.
What I would say is that I think DJ Quick said that said something like banging ain't nothing new and slanging ain't nothing new. Realize that vaccines are nothing new and viruses are nothing new. There's nothing new to this. They have been doing vaccines since the beginning of time, back with cattle and people, and it's in the Bible. That's why you wear the, you know, they cover up the Lord's Supper with the white sheet. It's all about cleanliness, right?
Yeah.
While you're waiting for your vaccine, wear your mask, keep socially distant. Those things actually work better than the vaccine themselves. All right, so that works. So let's do our part while we're waiting. I know things are stressful right now. You know, take a deep breath, calm down, know that things are not normal, and you should not necessarily feel normal right now. If you feel normal right now, you don't have any type of hesitancy about you. At that point, you need to make an appointment to see me, right? Right now, it is not normal, and it will not be normal to feel normal right now.
Yeah.
It's okay to feel abnormal, to feel a bit off right now. Let's ride it out, do the things that we can do to stay safe, take care of your mental health, get some exercise, walk outside, sunlight, deep breathing, meditation, you know, maybe get into your word or whatever you like to do to calm yourself down. But those things still work to this day. Just, you know, do your Netflix and chill. And if you're with somebody that week, you put your mask on, all right? But, you know, maybe
thank you
that
guys
on
so
too, but
much.
I'm just saying, listen, we can be safe about this as we get through this, all right? Y'all be safe.
Thank you all for this conversation. We truly appreciate this. Dr. Higgins, Dr. Jordan, Dr. Williams, thank you so much. The Houston Health Department, Mayor Sylvester Turner's office. Thank you all for being here with us today and getting this information out. We appreciate you.
Thank you for having us.
You guys have a great
Bye-bye.
night.